Hi class. So I'm going to talk about the three learning outcomes for anxiolytics, hypnotics, and sedative. This particular topic is separated into part one and part two. If you see on the classes of drugs for anxiolytics and sedative hypnotics, there are about five drugs there. But my lecture or the topics that we're going to cover would be mainly on barbiturates and also benzodiazepines. Yeah, so those are the two big names in as anxiolytics. And the main function of anxiolytic is to actually reduce or alleviate the anxiety and make it the nerves more calmer, in a sense calmer for the patients for the patients who tend to get anxious about things. Yeah? So the first learning outcome is you should be able to name the drugs according to the correct nomenclature, recognize and relate the drug structures to their respective names and drug families. Yeah, you should be able to know whether this is a benzodiazepine or this is a barbiturates and not NSAIDs, for example. Yeah. The second LO or the learning outcome is that at the end of a topic, yeah, you should be able to describe, compare and contrast, and discuss the historical developments, the SAR, chemical stability, and metabolic pathways of barbiturates and benzodiazepines. Yeah, so there's a lot of history in barbiturates. And you can see that the chemistry is quite a lot as well. Yeah, and what is similar to barbiturates? Sorry, is similar to in terms of barbiturates. They are similar. You also see them being used as anti-epileptics. They've got this Eurodiet framework. So the third LO is that you should be able to describe and discuss the chemistry and stability of chlorohydrate under different conditions. Another agents that have been used a lot in the past for many decades is, you can see down here, is chlorohydrate. It's got a special, very unique chemistry. So we should be able to describe and discuss the chemistry and stability of chlorohydrate under different conditions, aqueous, non-aqueous, and its tendency to self-polymerize. Also, we should be able to talk about, discuss, describe, compare and contrast with illustration. That is, you should be able to use chemical structures to talk about and write short notes to talk about barbiturates and benzodiazepines. Yeah, and you can see these here, ways to actually name and number benzodiazepine, for example, diazepam. Yeah, and you should know the metabolism as well. Yeah, and how it actually a structure of benzodiazepine can actually remain stable or unstable under certain conditions. So those are the three learning outcomes for anxiolytics, sedative, and hypnotics. We mainly focus on the barbiturates and also benzodiazepine, and we touch also upon the chlorohydrate